Hi, my name is Dr. Bassi. I'm an adult psychiatrist based in Florida. I was recently contacted by an undergraduate from the University of Buffalo to discuss what it's like being a psychiatrist. We discussed my recommendations for premeds who are looking to go into psychiatry and some encouragement if you feel like parts of your application could use some work. We also discussed a bit about how engineering relates to psychiatry and what I would do differently if I was an undergrad. We decided to record the interview in case it would be helpful to anyone else. I hope you enjoy it.
Okay. So I just have some questions for you. What did you major in?
So I majored in biomedical engineering. I knew I wanted to do some engineering. I also wanted to do medicine too. So that was the only one that really had the ability to do the prerequisites for med school.
So you went into med school after what was it?
I did a master's program after undergraduate. I took a little bit of time off. So I always really thought about medicine. I didn't know I wasn't 100% in on it. I actually felt very discouraged because a lot of people talked down about medicine and said it was starting to change and not be what it typically was. And there's a lot of dissatisfied physicians and they're unhappy. And that was very discouraging because I felt like I wanted to be a doctor, but nobody really sounded like it was a very good career path at the time. And so that led me down to a PhD route. So I applied for a PhD program in biomedical engineering at Columbia, started it, and I realized I was just so removed from the clinical aspect. I was I could spend days without really even talking to people, just on my computer, coding or working on a project or something like that. And it felt really not fulfilling. So I said, I'm always going to regret not going to med school and just doing it. And so I did and ended up loving it. I really enjoy my career. It's really fun. I don't feel like it's work to me. I'm working like all hours of the day. I don't like to keep track of my hours because it doesn't really feel like work. It feels like kind of a hobby or art, and it just feels so enjoyable to see patients and help out the practice too and help teach and supervise other people in the practice. So then after my master's program, which was really a PhD program just abbreviated, I went to med school and I had quite a bit of exposure to psychiatry from the master's program. I had done a master's in a psychiatric lab, essentially. The biomedical engineering program was my advisor was in a psychiatric lab. So it was a TMS lab. I don't know if you're familiar with TMS.
What does that mean?
Magnetic stimulation used primarily to treat depression, but other types of illnesses. And we were programming the actual device for different paradigms of delivery of the magnetic stimulation. And so I had about 2.5 years of exposure to a psychiatric research clinic, essentially. So patients were coming into the clinic to enroll in research studies at Columbia University. And so I knew what psychiatry was all about, and that was really helpful going into medical school. I talked about that a lot in my interviews and personal statements. Then I thought I wanted to go into emergency medicine. I really liked it as a student. I was very interested in the pace and helping people with acute issues. That was very hands on. You can do a lot of procedures, work with your hands. It was fun. I really got along quite well with a lot of emergency medicine physicians and other residents, individuals in the residency. They were cool, down to earth, easy to talk to, normal people. So I went into that career path and then I realized, no, I actually really like psychiatry. So decided, psychiatry as a career path is a lot more attractive to me. Even though emergency medicine was fun as a student, I didn't like it as a career path.
So you did your bachelor's and then you did your master's and then PhD.
I didn't do my PhD. It was a PhD program where you get your master's first, then you do your PhD. I left after I got my master's.
Okay. So then you went into
Yep.
med school after your master's.
Yep. Exactly. Mhm.
And where did you get your degree?
I did my undergraduate at University of Connecticut, my master's at Columbia, med school at University of Michigan. So I've been bouncing around a lot. And then I did my residency at University of Florida in Gainesville.
Oh, you practice in Florida, right?
Yep, I'm in Jacksonville,
Okay.
Florida.
And what is your position at your company that you're at?
So I'm the medical director, meaning I oversee any sort of medical or psychiatric issues. And I'm the owner of the practice. So I have a private practice that's only owned by me. I fully own it. And therefore, there's a lot of employees that work with me, and we all see patients and do therapy and medication adjustments, medication management.
Okay. And what are some core skill sets do you feel that best prepares for a current college student to have if they're pursuing a career in your field?
So I'm a psychiatrist. So I went to med school and then did a psychiatry residency. If somebody's interested in mental health, they can obviously be a psychologist where they have a PhD. They can be a licensed clinical social worker. They can go into marriage and family therapy. So if somebody wants to work in mental health, that is a huge, very general term. And if somebody wants to go specifically into psychiatry, that means that they have to do all the pre-med requirements and go to med school first. And then they're going to be exposed to different rotations within medicine. And then they'll have to continue to pursue psychiatry after medical school for another 4 years. So when somebody is thinking about psychiatry, they have to be geared towards going to med school first and getting all the pre-med requirements done, taking the MCAT, getting letters of recommendation, getting exposure to medicine in general. I think it's fine if you know that you want to go into psychiatry right from the get go. It's pretty rare that only about 15% of people go into psychiatry from med school, and of those 15%, not all of them knew that they wanted to do that right off the bat. It's not a very popular field if you think about all the other ones out there. So
Mhm.
somebody who goes into psychiatry obviously loves talking to other people and getting to know how they think. That's really what it does come down to. But if to exceed and excel, I mean, and do well in med school, you have to like and enjoy human biology and pharmacology, physiology. So those are the main coursework. Biology, pharmacology, and physiology, I would say, is what it comes down to when you're excelling in med school.
Okay. Then what are some experiences do you feel that a current college student should be interested in when they're pursuing a career in your field? Like, what do you think they should expect?
So I review a lot of applications and resumes for people who are interested in employment with the practice. I would say it's very almost stereotypical for people to say that they've had their own personal trials and tribulations in mental health issues, and that's how they got interested in it. It's kind of like a very old experience that I keep reading time and again. I would say somebody should have more than just personal experience within the field. They should also have a lot of professional experience in the field too, hopefully, where they've done volunteer work in maybe like a clinical setting where they've helped patients do various tasks or advocated for patients. There's a huge need for that. And plus, you
Yeah.
can get quite a very good ground there, foundation of how medicine works in general, and also talk about those experiences both in your personal statement and your interview. I wish I did more of that when I was applying to med school. I did a lot of research and I was very strong on the research front of things, but I shadowed a bit, but I don't think it was nearly enough that it should have been. So I shadowed maybe for like 4 weeks, and it was maybe one 2 hour session per week. So it was very, very minimal. I would say somebody should do shadowing or volunteer work, or being a scribe is actually also like a huge, huge way of growing and learning about medicine and getting experience and exposure, because eventually you're going to have to make that decision. Is this the right thing for me? Once you're in med school, you're like, do I want to do psychiatry? And so if you're a scribe, you've probably been exposed to other aspects of medicine and very in depth, and therefore can make a very sound decision and articulate that to somebody that it's like a very well thought out decision that you want to make, and you're completely dedicated to the field.
What were some specific experiences or courses that you took in college that you feel that helped you succeed in your career right now?
Maybe it sounds a little cynical or sad, but I can't really recall very many of them that are something I use right now. I took coding classes and I took engineering classes, biomedical engineering classes, biomaterials classes. I took civil engineering classes. There's a requisite for that too. And then all the basic education requirements. I was in the pre-med club. So that was fun and a good experience to meet and talk to other individuals too about what their goals were, how they're approaching the MCAT, what their timeline is, if they're going to take a gap year. I feel like a gap year is very common these days, and you can really set yourself up for a nice application by having a little bit extra experience in that gap year. So in undergraduate, I would say, focusing on your class and doing maybe some clinically oriented volunteer work and taking the MCAT is like quite a bit to put on your plate
Yeah.
already. It's like asking a lot already. So I wouldn't say I used any of my orgo or biology, physiology. I mean, probably do, and I don't even realize it. Maybe I'm using some physiology in there that I don't even realize that was in that class back then. So I graduated in 2006 from from undergrad. So it was, I don't know what, 15, 16 years ago or so. So it's hard to like think back of what coursework was in that class and then figure out if I'm utilizing it. Mostly stuff I learned in residency, quite honestly. It was my day to day clinical experience. What I draw from is a lot of the patients that I worked with in residency. We, have worked with people with depression, anxiety, schizophrenia, bipolar, OCD, personality disorders. So that's really a lot of the main foundation of medicine itself for me.
Okay. What problems or frustrations do you see with recent college graduates entering your field? Maybe concerns is a better word that you see when they are entering your field, things that they may do that just is a little bit concerning or frustrating that you could say may be a problem entering your field.
That's a really good question. You know, it's really hard to find anything like wrong with the individuals who I worked with who were in college. I felt like they were very enthusiastic and energetic and interested and devoted and very bright students. So I think as long as you go into a situation with openness and curiosity and being interested in learning and you're reliable and on time and attentive to detail and communicate well, I think that's all a clinician like me would be looking for when working with an undergraduate, you know? So being respectful of patients and helping advocate for the patients is really what it comes down to, making sure that people are getting the care that they need, but not overextending your bounds. So you don't want to like make any recommendations about medicine if you're not a physician or practicing medicine yet, but you still can provide a lot of support to somebody to try to help get them to the right place and listen to them, provide empathy, help out with appointments, help out with scheduling, understanding their bill, their EOB, stuff like that. It can go a long way.
If you were positioned to design a college program from the ground up, specifically to prepare students for a career in your field, what would you ensure it would include?
Obviously, you have to include all the basics because those still exist, although there's a lot of discussion the first 2 years instead of it being 2 years of biology based sciences, it's going to be 1 year, and then that will give you 3 years of clinical experiences. So I would say that it still needs to include physiology, biology, but I would say there should be more applicability incorporated into the lessons themselves. I can recall just being so immersed like a cell cycle that feels completely irrelevant to the practice of medicine as a whole. And, unless you're going into doing your PhD in some sort of cellular biological process, it's very difficult to understand why this is important to you in the long run. And that can
Mhm.
be very discouraging to a lot of students because they're trying to think about an enantiomer and how it looks and trying to just bury themselves in microbiology and biochemistry and organic chemistry. And it's like, what does this even mean? And how is it going to affect the patients I want to see? Because medicine is very social. As I mean, psychiatry is, and maybe not radiology, but surgery, family medicine, everything, even anesthesia, even though you're putting them under anesthesia, the pre-op, post-op, you're still interacting with patients quite a bit. So you need
Yeah.
to know how to communicate very well and having many credits and long hours of studying a cell cycle, I feel like is just not really where a lot of students need to be focused on, but that's really just a requirement to prep them for the MCAT and med school. So unfortunately, a lot of the undergraduate requirements, prerequisites depend on their prerequisites for a reason because that's what med schools are requiring. So until med schools change their prerequisite requirements, the undergraduate system kind of needs to still have those and include those, but hopefully there's a little bit of clinical relevance to them incorporated into the coursework. So there's so much you can go into. I mean, you can totally give a vignette of a patient and a situation based on some sort of the underlying biology. That way it will give the student this way to apply it to a person. And then when they see a person and a patient with that situation, they could think back, okay, I remember how this process worked, and it kind of makes it more relevant to them at that
Yeah.
time.
And I just got another, just a question that I thought of. How does engineering relate to psychiatry? Like, where does engineering come in?
Well, that's a really good question. So, in a few different ways, but the way that I'm familiar with is the delivery of electronic stimulation to the brain to help re-regulate circuitry in the brain. Depression and anxiety and even schizophrenia can be thought of as a misfiring of particular circuit in the brain, meaning a pathway of neurons to different parts of the brain. So if generally speaking and very putting it very basically, for depression, for instance, if there's a slowing of that circuitry, you can use external factors such as external stimulation like ECT, electrical convulsive therapy,
Mhm.
and TMS, which is magnetic stimulation, to start to upregulate that circuitry that was now artificially like kind of slowed down because of depression. And same with things like OCD. So you can use deep brain stimulation where you implant an electrode into a particular area of the brain to start to re-regulate that that location. And then the effects are, like, surprisingly miraculous. It happens, like, almost instantaneously when a patient is coming to follow up and they press the button, and certain thoughts and feelings, they just, like, get eliminated immediately.
Wow.
So, those devices, the biology behind where it's going, all of that, people work with engineering teams to help improve those things. So biotech companies in healthcare, they have teams and teams of engineers that help work on these things. And that's from the biomedical side of things. And then there's computer science where you could be programming an app, you can be programming a VR device. So that would be a computer science type of individual who can maybe help out in psychiatry and mental health. We didn't get into pain, electronic stimulators of the spinal cord to help treat pain. And there are some psychiatrists who do that and go into pain management. Trying to think if there's any others in regard to psychiatry and mental health. Pharmacology, medication delivery systems. There's new versions of Suboxone and Abilify and they're basically trying to come up with ways of delivering the medication in a way that is bioavailable, meaning available to the body, but in ways to reduce side effects. So depending on how it's getting into your body and the rate in which it's delivered to the body and yourself, you could either have very high side effects or very low side effects. And so that is another aspect of how engineering can relate to psychiatry is the delivery of medications.
Okay. Thank you. I didn't know any of that. So thank you for that.
It's a cool field. I mean, if you're interested in engineering and mental health, then there's definitely a lot of overlaps there.
There's such a wide range of things you can do in mental health, and you really don't know until you talk to so many different people. So it's just interesting to see all the different aspects of mental health and what you can do in mental health.
Oh, totally. I wanted to mention that too because even when it sounds like you're being pigeonholed into psychiatry, oh my gosh, I'm going to psychiatry. The field of psychiatry is so broad. You can do corrections, you can do outpatient, you can do academic medicine, you can do child and adolescent, you can do addictions, you can do forensic psychiatry, um, you could do geriatric psychiatry, and all of them, like, their day is so much different. Like, if you look at just one person and compare their day to a person in a different aspect of psychiatry, it's just night and day different as to, like, what their day is like. So and even within those fields, depending on the place of service, like inpatient versus outpatient versus in a jail setting versus in a facility versus an IOP program, like an intensive outpatient program. Those are all different environments too.
Interesting.
Yeah, it definitely is.
Okay, so I have another question. Please explain the importance of effective writing skills in your career.
Writing, communication, verbal communication, without it, you'd be disabled in our career path. I mean, I remember I had laryngitis and I didn't call out because it's my private practice and I really wanted to see people, but I was so hard to speak. And it's just really hard to see patients and treat them without the ability to speak. Was there a reason you wanted to know about written communication versus oral communication?
Well, this specifically is for writing class, so that's why they asked. But I feel that oral communication will probably be way more important in your field.
Yeah. Well, written communication, so one of my writing things, writing prescriptions, if you make an error in that, that could be it could be life and death. First of all, it could be very confusing to the pharmacist or the patient. And there's a very specific way to write a prescription. The notes themselves, so we're writing notes quite a bit, and they could be helpful for me, the patient, and the insurance company, and any subsequent treating clinician. So you have many audiences to your note, the clinical note that I'm writing. And that makes it very difficult because am I writing this for myself versus the patient? It could be like different the way I would speak it, the way I would explain it.
Yes.
You tend to find your style in residency because you're seeing a lot of other people's notes, and people are also giving you feedback on your notes too. And so there's definitely a lot of improvement when you're first writing a note versus like when you've done it for a few years. There's a lot of abbreviations and there's a lot of different styles that people have. So when you're in residency, because you are often on consulting services and you're seeing other people write their notes, you can kind of see what is a nice, clear way to communicate this to another clinician. So that's all I can think of in regard to written communication. There's some marketing aspect to being in private practice, and you need to be a good written communicator to often a lot of our communication with patients is written. If I'm patients can email me, they can send me a message through our patient portal as well. So we are often communicating with patients in written format too.
So then I just have a personal question as well. So I'm also thinking about going to med school. Math is the hardest thing for me. Like, I can do anything else, but math, it's like my brain just stops. Is it a lot of math, or what would you say? You can give me any tips or any advice on that?
I don't think there's I wouldn't say a lot of math. I mean, I know you have to take is it calculus for a prerequisite requirement? And then in medical school, the math that you're doing is not a whole lot. It's not like you're doing trigonometry or calculus. You're not doing differentials, integrations, that sort of thing. You're doing a lot of arithmetic. It's a lot of fractions. Do you remember patients and populations class where you're calculating percentages of probability, odds ratios, and that sort of thing? So, because in studies, you want to know what is the background rate of a particular illness, and then you apply a treatment to it, and then the treatment hopefully will reduce the incidence of that disorder in the population. So you have to figure out like what is the effect size that it has. What is the odds of an individual developing an illness based on an exposure to some other sort of substance like smoking? So calculating a lot of fractions and a lot of percentages is very common in a few years of med school, but I wouldn't let that discourage you from going into medicine if you're not interested or good at math. It's not a whole lot of math.
Okay. Well, thank you for that. That helps. Yes.
Yeah, don't worry about it. You should still do it even if math is not a strong suit. What kind of volunteer work are you doing or other sort of extracurriculars?
Well, right now I'm in foster care. I don't know how I ended up here, but I absolutely love it. I was doing before that, I was in a mental health program for the homeless population. And then before that, I was in addiction mental health. So I'm
No
really
way, that's
into mental health.
awesome.
Yeah, I love mental health. I'm a really a big mental health advocate. And
Nice.
eventually, I'm trying to do something with nonprofit for specifically men with mental health issues because I feel like that is something that we're really lacking in the community right now, all across the board. I feel like for men with mental health issues, just trying not to limit to anything because I really want to just keep going to school. I just love to learn, honestly.
Then medicine's perfect for you because there's a lot of lifelong learning with that. What holds you back from going into med school?
Really just my math. That's about it. And then I work. I have to go to work too because I mean I have rent and all those things. So it's really just trying to find a balance of everything because when you're in school, especially after I know I graduate with my bachelor's, I'm gonna have to like my master's program and things like that. It's gonna be way more work and I'm gonna have to really set aside way more time to do my schooling. So I'm just trying to make sure I'm probably going to take time off of work when I do my medicine practice because I know that's going to be a lot more challenging.
Yeah, definitely. But it sounds like you have one good trait that you need is just being really hardworking because it's not about necessarily intelligence, it's just really honestly about persistence. If you really want to go to med school bad enough, you don't need to get into a top med school. It's not like law school where it's going to be like really hard to find a job unless you're in a top tier law school. You can go to a decent medical school, do a decent residency, and you end up in the same place. You end up in the same place as everybody else, and there's lots of work, there's lots of jobs out there for physicians. Once you get through medical school and residency, you're kind of like on the same trajectory as everyone else. So don't let grades or MCAT score or anything like that discourage you.
Well, that is encouraging. And so I remember when I was signing up for my classes and I told them I wanted to do that, they said that medical school is very competitive.
For the top ones, yeah.
Okay.
For the top ones, yeah. But if you say you get an average or below average MCAT score and you have an average GPA, but you show that you're dedicated to psychiatry and mental health because of all of these experiences, and you have just kick ass letters of recommendation, personal statement and you can speak to a lot of clinical experiences where you've advocated for patients, I think that a medical school would probably take that person over somebody else with the opposite type of situation.
So, do you recommend specific things I do before applying for medical school, like internships? Like, what kind of internships do you think I should go into beforehand?
Internships before med school?
Yeah, because you said recommendation letters for experience. Like, what type of experience or internships do you think I should be interested in for medical school?
The volunteer work I think that you're doing now is phenomenal. If you stick with that and work and continue to show dedication to that and get
Okay.
a really good letter, and if you can look into being a scribe, that's also a really, really good experience. People who have been a scribe, they already have a very good grasp of medicine. I wish I had known about that. It's a very advantageous activity to do, and one which you're spending your time in a very, efficient way that, you're spending 8 hours listening to doctors talk to patients. It's not only shadowing, you're involved in the care, you're writing, you're understanding their decision making. You're right up close with patients and seeing their experiences. So being a scribe is huge. I don't I'm kind of disenchanted by research, but back in the day, and I knew a lot of my classmates, they also did a lot of research. But if you're interested in research, there's plenty of that to be done too. I just
Um,
find it hard to get like an actual outcome from research unless you have a paper or project or results, which takes a lot of work.
yeah, definitely. How long was med school for you, like in total with your residency?
So med school itself is 4 years unless you do a gap year, or like take a year off for some people take a year off for mental health purposes, for research, to get a master's of public health, and you can do a 5-year medical school program with a master's mixed in there. That's not uncommon. And then residency for all psychiatrists is 4 years.
Okay.
So that's to be accredited by the ACGME is the accrediting body for residencies. So they mandate that it be 4 years for all psychiatry residencies. So that can't change.
Okay. Thank you.
Yeah. So different residency programs and different specialties, then they'll be different. But if you're in one specialty, thinking of psychiatry, it's always 4 years.
Okay, I didn't know that. Hey, well, I don't really have any other questions for you. I really thank you for taking the time out of your day because I learned a lot actually.
Yeah, just keep connecting with other doctors. That's how you get to know if it's a good fit for you. You get to hear their experience, their opinions on medicine, how happy they are in their career path, whether or not they would do it again, what they would do differently. So definitely keep talking and keep involving yourself in medicine. There's so much innovation, so much need out there.
There is.
It's a really exciting time to be in medicine.
Thank you. And I'm happy to hear that you love your job and it's like a hobby to you. I'm really happy to hear that.
Yeah, no, it's a blast. I thoroughly enjoy it.
That's good to hear.
Yeah.
Thank you so much.